Hi everyone, welcome to another interesting episode on Prime Health 360. Let us think about that one health symptom that can make us visit the doctor's office. Have you thought about one? Now, there are some symptoms we can have that we feel that is too minor and we can easily dismiss it. But those symptoms are actually warning signs that we need to visit our doctor's office for proper medical checkup. My name is Dr. Kelly and you're welcome to Prime Health 360. In this video, I'll be talking about symptoms which we see in our body that we should talk to our doctors about to get a proper medical examination and laboratory investigations about. Number one on that list would be rapid weight loss. If you're trying to lose weight and you are on a healthy diet and you're losing weight, that's a good sign. But if you're not even trying to lose weight and you find yourself losing weight excessively, that is a red flag. You should see your doctor for proper medical examination. Unexplained weight loss can be a sign of stress, depression, chronic infection, cancer, or even digestive problem. So when we find ourselves losing weight when we're not even trying to lose weight, please let's see our doctor to run proper medical examination on us. The second on that list will be shortness of breath. Shortness of breath is when we can't breathe properly. We find ourselves losing breath occasionally. That is a red flag. That can be a sign of heart attack, especially if you're having that shortness of breath and you find yourself having pain in your left arm. That is a sign of a heart attack. So please go see your doctor for proper medical examination and laboratory investigations to be carried out on you. You could possibly be having a heart failure coming down the line. Next on that list will be chest pain. This is a sudden chest pain that happens at random and is accompanied by nausea, vomiting, and shortness of breath. If you also find out that is associated with the pain in the left arm, that is a sign of a heart attack. Please go see your doctor for proper medical examination and laboratory investigations. Another thing is persistent fever. If you find yourself having a body temperature above 37.5 degrees centigrade consecutively for 3 days, please see your doctor. Fever is a sign of a chronic infection. Take, for example, the COVID-19 virus. The first sign of the COVID-19 virus is fever. So if you find yourself having fever or feverish feelings, please go see your doctor for proper medical examination, especially if it has lasted for 3 days, a fever that has lasted for more than 3 days. Please go see your doctor so they can examine you properly, take your blood samples, run some tests, and be able to detect the cause of that fever. The next on the list will be abdominal pain. If you have any abdominal pain at all, please visit your doctor for further investigation. It could either be you have an appendicitis, a gallstone, an obstructed bowel. So please go see your doctor as soon as possible. Also, if this abdominal discomfort is accompanied by diarrhea, black or bloody looking stool, please go see your doctor. That is a dangerous sign and a warning sign that you might be coming down with a very severe chronic infection. The next on our list will be skin changes. The skin is the largest organ of our body and it can be used to detect the state of our health. If we find yellowish discoloration in our fingertips, that's a sign of jaundice, which can indicate a chronic liver disease or a kidney disease. Also, let's take cognizance of skin bumps or skin lesions we find on our skin. Most of these bumps can be cancerous. So when we find them, let us go to the hospital and get them examined to know if they are cancerous or not. The next on our list will be headaches. Headaches that are occurring frequently and lasting for a long period of time, and they even affect our daily lives. Those headaches should be taken seriously and be reported to a doctor as soon as possible. If you notice that this headache is associated with numbness in our palms and feet, please go see your doctor for proper medical examination and laboratory investigations to be carried out on you. So if you're experiencing any of the symptoms like an unexplained weight loss, skin bumps and lesions, fever, headache, or any of the ones I mentioned previously, please make an appointment with a healthcare physician to get a proper medical examination carried out on you. If you have any symptom that I haven't already talked about and you want me to talk more about it, please write it down in the comment section. I'll be responding personally to your questions. Questions to ask your doctor after the doctor has finished making the diagnosis. The first would be, what type of disease is this? What is the cause of this disease? How does this disease affect my home and work life? What are the prognoses I have? What symptoms should I be looking out for? And last but not least, how frequent should I come for my follow-up visits? These questions are very important for you to ask your doctor, especially when the doctor has made a diagnosis on you. Questions to also ask your doctor about your treatments. Number one is, do I have any other treatment options? How long will my treatment take? What is the cost of my treatment? What side effects can I expect? What are the risks and benefits associated with the treatment? And will my job or lifestyle be affected? And what are the prognoses? Will I stop taking this medication in the long run? Those are the questions that you can ask your healthcare provider when you're being placed on a treatment plan. Subscribe to our YouTube channel and hit the notification bell so you'll be notified whenever we upload a new video. Follow us on our social media platform and do visit our website www.primebusiness.africa. I remain your host, Dr. Kelly, and until our next episode, this is Prime Health 360.